Smile evening, friends. Smile evening, one and all from the Joshi Kerala group. Actually, this is a very serious section, but it is very simple. Madam Bhupinder Kaur is giving this session so many times for Joshi's Kerala group. Still, she is very much interested in giving the subject from the basics itself. It is related with the basic Sujok therapy by using the seeds. And she is conducting this from the basic level to the higher level. When you listen to the session, you can get so many things from the advanced Sujok therapy also. So please be patient and be in the Zoom till the end of the session. And last time she is dealing with the structure, the bone, joints, so many things. At that time, another participant is calling me and she's told me that she didn't know where to give an energy point for the finger pain. If a pain in the fingers, where should she treat? She doesn't know that. Actually, she's a person who is attending all the sessions from the Joshi's Kerala group, especially Madam Bhupinder Kaur. She says as if we are attending Madam Bhupinder Kaur in live sessions, that itself will helps to heal, not for her, but even for her family, friends, relatives, and all, because of the connection with that divine force. So, if you want to see the previous sessions, please be in the Joshi's Kerala group. We will provide all the recordings, and also you will get the recordings in YouTube also. For today's session, we all together welcome our Guru Ma'am, Madam Bhupinder Kaur, to this session. Smile evening, ma'am. Smile welcome. Now we are waiting to hear from you for the continuation of the session, ma'am.
Smile. Smile evening to everyone. Okay, so we will start our session. As we are studying seed therapy, and in our sessions, we will be focusing different types of diseases. And in Monday series, I will try to touch many diseases. But with all diseases, we have to add a special treatment so that patient can recover very soon. When person has a very old disease, and we say chronic disease, if he is having chronic disease, then in that case, we add energy point treatment. Because many times you will hear from me that along with this important point, for example, patient has chronic stomach disease, chronic joint pain. Like last time you saw, I introduced how to treat joint pain. And then before joint pain, I introduced how to treat spinal cord diseases. So same like all these diseases, I will highly recommend, especially patient is having old disease, chronic disease, to add energy point treatment. This energy point treatment looks very simple treatment, but this is very powerful treatment. Professor Park Jae-woo's special research on energy point treatment, it is not just simple points on central line. It is based on our special meridians in our body. So as per our classical meridians, we have CV meridians and GV meridian in central body. And as per diamond energy system, we have core meridians, we have central border meridians. So Professor Park Jae-woo, he selected very important points from CV meridian and GV meridians, and after practicing on patient, after doing research, he found that these points are very effective for patients. So if patient is having old disease, chronic disease, in that case, if you add this treatment, he will recover very fast. So in future, I will be touching chronic cases, very serious diseases also. And with that, I will definitely say add energy point treatment. So don't forget this session, because in today's session, energy point treatment I will be introducing, and then this kind of treatment we will add with all chronic cases. Now, not only chronic cases, if patient is having fatigues, pains, and patient is having some, chronic, as I said, chronic diseases and serious cases like cancers, then ulcers and degenerative diseases. And if rejuvenation is required, regeneration is required, in this case, it is very important to treat energy points. And sometimes what happens when we treat patient, result is not coming. This is very important thing. We are treating with many techniques, but we are not experiencing the result. Patient is not getting any relief, or he gets relief, but disease comes back again. Then it means we need to focus his energy point. It is very, very important. If you treat this energy point for 2 weeks continuously, patient's energy will get harmonized. And when patient energy is harmonized, in that case, your all treatment will become very effective, very effective. Whether you use Sujok therapy or any other therapy, it's not just about Sujok therapy. Once energies are harmonized, body becomes receptive to receive your treatment. So it is very, very important that you focus this energy point treatment. And also, as I have introduced many times, that before doing treatment, you should find painful point. Many times we will hear from people that I stimulate with probe, but I don't find painful point. Yes, then in that case also, it is very important to work on energy points. So also I will introduce today that in which case, because we have several energy points, not necessary that you do all energy points. Sometimes we need to do all energy points, and sometimes we have to select few energy points. And where are these energy points? First of all, we have to understand that these energy points are located on the central line. Yes, central line. Front body central line and back body central line. So this is a front meridian, front central line. This is a CV meridian, a conception vessel meridian, and back central line is governing vessel meridian. These are royal meridians. Very powerful energies are flowing in these meridians. And according to diamond energy system, deep inside in central line, we have core meridians also. And in our Vedic science also, we have studied that we have Ida Nadi, Pingla Nadi, Sushumna Nadi. So these are again in the central area of our body. So, and this central area, this central line is connected to this because the powerful energy flowing in the central line has connection with all parts of body. It is very simple topic, but it is very, very powerful. We should not underestimate the power of energy points. Many times I have observed that if I give treatment on energy point for 2 weeks, yes, for 2 weeks, many diseases are harmonized. Without treating the disease, many diseases are harmonized. So, in body, central line. First of all, we have uh, we have focused in our previous session. We have studied basic system and insect system. If we understand that central line is very powerful, then where is this central line as per the basic system, and where is this central line as per the finger system or insect system? And I will show this line. We will first see the diagram, and then I will show on my hand and how to do treatment practically. We can do with needles, we can do with seeds, we can do with crystals, moxa. So all these techniques I will show to you practically. So please stay with us until the end, because this topic I will not introduced in my next lessons or next session, because uh, in our next sessions I will be touching all diseases, yes, many diseases, and with all chronic diseases I will mention this treat energy point also. So you should not forget today's session based on energy points. Okay, so now first we will mark the points, we will make the diagram, we will learn where is this central line and where are the energy points on central line. So I'm sharing my screen, just a moment. So see, I am teaching here from beginner's point of view. I know many people are here. They have listened my lecture before also, but our purpose is to teach our new participants, and also we respect our senior participants, senior students. But every time you listen, you will get something or something new because of our experiences in our journey. So, first of all, where is this central line? This is basics. This is main body. In main body, this is central line. Yes, front central line. And back view, this is back central line. And on this line, we will study energy points. So where is the central line in basic system and insect system? So in basic system, as you all know that hand is similar to human body, head, neck, chest, abdomen, 2 legs, and side 2 fingers are the arms. So you will see on my hand also. Until and unless you see on real hand, we will not get that kind of clarity. So first, for diagram's sake, so that you can take screenshot, this is yin surface, and on yin surface, we have 6 energy points. Now, how to remember this? How to remember? It is very easy. First is focus this central line, and then starting and ending point. You will see that energy points numbering system. It is from lower, because these 2 fingers are corresponding to the legs. So this becomes lower area. So energy as per CV meridian. In royal meridians, energies are flowing from down to up. In actually, CV meridian, GV meridian starts from the anus lower area, and energy moves as per lunar diamond. Energy moves from down to up like this. That is why you will see number 1 in this lower area. And in GV meridian also, from anus to upward, energy is moving like this. So why this direction is important? When you do moksha, because we will learn moksha also, when you are doing moksha, it is very good to start from lower area. And when we see this on our basic system, this becomes lower area. Yes. So now you know that why one number is written here. Now, in this line, this is like starting in this line, this is starting point and ending point. How to remember these energy point? Then center point. This is exact center. Yes, easy. This is center. And then after finding the center, this area you divide into, this is center line. Yes. Then you can see two halves. One is this and second is this. So you divide this area into 3 parts. Easy, very easy. So 1, 2. So now you see this is 1, 2, 3. So 3 parts. And this side also 1, 2, 3. So 3 parts. So this area, when you divide into 3 parts, then from lower, if you see from lower, then this becomes 1/3. Yes. And next energy point is here. This becomes 1/3. And in this part, from the wrist, because after dividing this area into 3 parts, first we will focus the wrist. From wrist, 1/3. Yes, so this becomes next energy point. Yes, and below the thumb, this on the base, first energy point, and on the wrist, starting, because starting and ending of this line, and then center point. As a result, you have 1. Let me think. So as a result, you have 1, 2, 3, 4, 5, 6, 7. 7 energy points. And let us see on the yang surface. So yang surface has 6 points. On the yin surface, we have 7 points. And on the yang surface, we have 6 points. And it is again very simple. But you have to pay attention on the central line. On the yin surface, when you see this central line, these two central lines are meeting on the wrist. See this wrist point? So this side central line and this side central line is meeting on the center, in the center point of wrist. But when you see the yang surface, these two central line are not meeting at all. This is very, very important. Yes. So if you see your the area below the thumb, you will find one bone here. one bone. So this line is ending on the bone level. This line, bone level. This is very simple. This is exactly running between two legs. This is the central line. Yes, so this is very simple. Starting point, ending point, and find the center point. Yes, and then here also, this is bony part. You can feel this bony part. The joint is here. One point is here, and then this is the fourth number. Find the center. So on the yang surface, we have 6 energy point, and on the yin surface, we have 7 energy point. Now, let us see on the finger. And then, of course, I will tell that which point in which case, yes, and finger system, how to do, how to apply seeds on fingers and how to apply seeds on hand system. So in foot also we have energy point, but on hand we can do very good treatment because easy to maintain the point. Feet we are using for walking. So if we apply fixed seats, it can come out also. But I recommend that you should do, sometimes you should walk bare feet on rough ground. Yes, this is also very good on rough ground. Morning time when you are going for a walk, then bare feet walking on grass, on rough ground, it is very, very good. Okay, but in some difficult cases, when patient is bedridden especially, then it is very, very important you treat foot energy point also. Yes. So in emergency situation, even if you don't know the points on the feet, you can do deep massage on the central line. Just deep massage. Yes. And here we will focus more on the hand system and finger system. This is yang side. For thumb, for massage, it is very good. You can massage this with your thumb. But hand, we will do perfect treatment. We will use seeds, needles. I will show needles also today. So according to finger system, where are the energy points? So first is, this is finger joint. This is the joint area. And now this part is your bony area. Bone, you can feel here. This bone here. Yes. So first energy point is on the bone level. And then next on the junction. First you can mark on all junction. Easy to remember. You see, these are all junctions. Joints. And this is the last bone. On all joints, energy points are available. And then find the center. Yes, again, these are the joints. And this is bone level. On each junction, you will find the energy point. And then find the center. This is center area, center point in this phalange, and this is also center point in this phalange. Easy to remember. Okay. So in finger, front side. This is called front side. This is called back side. Nail side is yang side, and this is called front side. Now, let's see energy points on the yang surface. Yang surface, this is the central line, and see the junctions. This is the junctions. Here, see on the yin side, we have a skin line here. Yes, but on the yang side, we don't have skin line here. We don't have line here. Our finger is finishing on this bone level. Yes, so this we have three junctions. Simple. On the yang side, we have one energy point less. So we have three junctions. First, find the junctions, and on these junctions, we have energy points. And then find the center. Find the center. Yes. So this is the place where we will apply. We will apply seeds or colors or moxa, needles. Yes. And now let us discuss about few diseases. I'll give you example. First of all, uh, in female, right hand is first choice. If you are planning to do energy point treatment, then for female, right hand is first choice. And in male, left hand is first choice. Then, second thing is that if a patient has chronic diseases, then yin surface, this is called yin, this is yin hand and this is yang hand. So yin hand energy point is highly recommended, and in new diseases, acute diseases, yang side energy points are recommended. So if person has chronic disease, then you treat yin energy point. If person has new disease sometimes, weakness, fatigues due to some hard work or some, like for example, you have a marriage in your home, function party in your home, and because of this activity, you have done a lot of physical work, and now body is having pain, suffering, senses there, and now you can understand that this is not old disease, this is new type of, this is newly appeared fatigue, but it is recent. In this case, yang energy point is good. Okay. Now, also, I want to say that when a person feels sick again and again, yes, again and again, then also we can do energy point treatment. Uh, yin surface, yin surface is very important if person is having disease since many years, since many months. Yes. And if person's hand, feet cold, are cold all the time, when you touch, you feel cold, then also energy point is very good. Cold body, cold hand, cold feet. Yes, energy point, very good treatment. Also, weak immune system, long chronic diseases. And as I told you that if your treatment is not responding, then you should first do energy point treatment for few days, at least for 2 weeks. And I will show, I will demonstrate how to do this treatment. But I'm telling you the situation when you can do energy points. And in fatigues, as I told you, and in daily routine, if you feel lethargy, then also this is very good. And sometimes we feel that we don't have any disease, but we don't have enough energy for routine work. Yes, we are tired all the time, then also energy point, do it for 2 weeks at least. Yes. And also you can do for your general maintenance. Once in a week, if you feel that I am fit, I am good, no disease, no fatigue, in that case also for general maintenance, once in a week you should do. Weekend, Sundays, you can do this energy point treatment after learning the application. And sometimes when you press a patient hand or in you press patient in body someplace, when you press, if you see blue marks, and also if you see blue marks in several places, yes, blue, suddenly blue mark, yes, in Hindi we say नील पड़ जाते हैं, blue mark. So this is also uh, an indication of deficiency of energy. Yes, blue mark. In this case also, you should do energy point treatment. And uh, you can you can check, like sometimes when we are massaging a patient body or some point, very soon that area becomes blue. Yes, this is also an indication patient is having weak energy or deficient energy. So if simple massage, if by simple massage skin is becoming blue, it is a sign of deficiency of energy. Yes. And in healthy condition also, you can see on massaging, skin becomes blue because of deep pressure. But the difference is that in healthy person, very soon, quickly, this skin will recover and you will see normal color of the skin, and you will see skin becoming blue. Oh, sorry, skin becoming pink. This is the difference between healthy and unhealthy, or weak or good energy. So, if you need extra stamina, if you need extra stamina, sometimes like we are planning to do heavy work. Yes. For example, tomorrow I have a lot of works. I have to go to my office. I have to go to the market, shopping, and a lot of guests are here. And I have to go to uh, my friend's place and many other activities. Yes. So I need extra stamina. In that case also, it is very good day before you can do energy point treatment. Then if organ is showing deficiency, yes, insufficiency, organ is shrinking, organ, this you will come to know with medical reports. Organ is shrinking, degenerative process, and organ is not functioning well, like weak digestion, for example. This is old case. Then also energy point. This is very important because these points which you see here, it is not just point. It is very special area because I told you this line has a very special uh, this is very special area which is connected to our central border meridians, connected to core meridians, connected to lunar diamond, central meridians, solar diamond, central meridians. And if we if we stimulate this line and special points on this line, it can activate or it can influence all parts of body. This is not simple. Yes, you have to experience this. So now I want to discuss I want to show on my hand also. Then again, I want to say that this energy point is not the final treatment. You have to add with your with your diseases treatment. For example, like last time I said, patient is having, for example, chronic knee pain. So definitely you will do knee points. Along with that, you will do energy point treatment. So this is additional treatment, and not it is not focusing the disease. When we are doing energy point treatment, it is actually preparing the platform. It is harmonizing, as I told you, it is harmonizing our energy level. And when energy is flowing rhythmically, harmoniously in our body, then quickly it can clear the disease. When you do treatment, then body will accept very quick, very soon. And now I will show on my hand and then how to do the treatment. So I'll share my screen, another camera. Just a moment. Just a moment. See. Show my camera. Okay. I hope you can see my hand. My hand is clear?
Yes, ma'am.
Okay. So when you see on real hand, then very easy to absorb, easy to understand. So first, see the central line. I'm focusing first on our hand, and then this is finger system. This is insect system. So this is central line. This is central line. And on the central line, you can mark first point, and on this line, this is the last point. Yes. So you can mark also before you do any treatment, you can do this marking. Okay. And I recommend that when you're doing marking, you can do with red color or orange color. As per color therapy, we use red color or orange color to activate this energy centers. So starting and ending point, and then find exact center. This is the center area. And as I told you, now this area, now you have, after finding the center point, then you have two half. One half, and this is another half. So in this area, this area you divide into three parts. Like for example, imagine one dot here. Yes. So this becomes 1, 2, 3. So from lower, 1/3. After dividing this line into three parts, then from lower find 1/3. This is our energy point. Now, in this area also, this line, divide this line into three parts, and from wrist point, this is from wrist point, find 1/3. Yes, so we have this energy point. As a result, on this line, we have 1, 2, 3, 4, 5. Now, see this central line, as I told you on the yin surface, this central line, these two central lines are meeting on the wrist point. So one point is already here. Then this point is here. You can see at the base of the thumb center. And then this point again, center of this line. Very easy, simple. And then on the yang side. On the yang side, between two legs, according to basic system, middle two fingers are corresponding to the legs. Then this is your central line. First point, wrist point, end of this line, and then center. Then come this side. Now, see the difference? On the yin side, these two lines are meeting on the wrist point, and on the yang side, you can see the gap, no meeting. Okay? So, on this bone, first, when you bend this bone, this here you will find protrusion. On this protrusion, you will find one energy point, and then see, you can feel with your finger, bone is ending here, and you will find one energy point here. Then find exact center. As a result, you have 6 energy point on the yang surface. Now let us see finger. In finger, where is this energy point? First, on the junctions, easy to remember, 1, 2, 3. We have 3 junctions. So, you can find energy point on the junctions. And then, exact center. This is center. Finally, this is last point on the bone. Backside. First, find the junction. You see, this is your joint. On the joint level, one energy point is here. And then this is next joint. On the joint level, you will mark one energy point. Yes, and then when you bend your finger, you are bending on this level. So, this is your bony area. One energy point is here. Now, after making energy point on the junction, find the center point. You see, between two joints, this is the center point. And here, between two joints, this is the center point. Okay. I hope points are clear on the yin surface and yang surface, on the hand system and on the finger system. You can write in the chat box. This drawing part is clear, and we will go next. Good. Very good. Okay, good. And now how to do treatment? In chronic cases, in very severe cases, it is good to treat all energy points. But sometimes you can select also. For example, sometimes not everyday patient is ready for many points because he has to go to office or maybe some work. So not easy to do all points. And in that case, now you can select 3 points. 3 points. First of all, you should have full information about our correspondence system. Head, neck, chest, abdomen, 2 legs, and side 2 fingers or arm. First, we will see our hand system. So, you have to find the nearest 3 energy point. For example, okay, question you can select. If patient has leg pain or patient has heel pain, of course you have to do treatment or heel. If patient is having heel pain, yes, you have to do heel treatment also. But along with that, this is additional package with your main final treatment. Okay, so let's say one patient has leg pain. So I will write the numbers and you will tell me. For example, 1, 2, 3, 4, this is 5, 6, 7. Okay. Now, patient has leg pain, then please write in the chat box which energy point you will select in case you have to select few. Number. Very good. Yes. 1, 2, 3. Correct. And if patient has head-related diseases, face problem, neck problem, then which energy point you will focus? 5, 6, 7. Very good. And if patient has stomach, spleen disease, patient has liver problem, then which energy point? Oh, very good. 3, 4, 5. Yes. So you can select at least 3 points. And if patient has backache, lower backache, then definitely you should focus back energy point because patient is having backache. So 1, 2, 3, 4, 5, 6. Low backache, which energy point? 1, 2, 3. And because 3 is very far, you can just focus 1 and 2. This is enough actually. Yes, 1 and 2 because 3 is very far. Yes. And if person has some head disease, nearest energy point, you can focus. Yes, 5, 6, 5, 6. So 3 or 2 you can select. 3 or 2. And if patient has arm disease, then in this case, arm disease. Because you see, arms are just, you see, it is very close to the neck area. So you have to focus, this is neck. Then the nearest energy points are 6, 5. 6, 5. Yes. And on the yin side, 7, 6. Okay. Now, another way is, of course, when we are treating for 2 weeks, because I told you, in case patient is suffering since long, that do this energy point for 2 weeks, every day. And every day you will see a big change. You will feel fresh, you will have good sleep, you will feel energetic. And of course, after this discussion, we will do practical also. Then when patient is coming every day, then some days you can do all energy points, like chronic cases, as I told you. Chronic cases, I told you, focus on yin side, and acute cases, new diseases, you can focus on the yang side. And some days you can just focus the nearest 3 energy point, because for 2 weeks patient is coming to you, so you can do all your you can use all these tips. Someday you can do this, someday you can do that. This is all focusing the supporting your main disease. Another technique is front to back to. Like, patient has leg pain. In very serious cases, severe cases, it is very good to focus yin and yang, both. So, leg disease or uterus disease, yes, lower area. You know, in basic system, this is the lower area. As per our previous session, you know that this is lower abdomen area. So, energy point number 1, 2 on the yin surface, and back also 1 and 2. Yes, this is also one more technique to support lower area. We are focusing 2 energy points on the yin surface and 2 energy point on the yang surface. Like, if person has lung disease, heart disease, you know that this is the chest area. Yes, this is the chest area. Lung disease or heart disease. Then 3 energy points, 7, 6, 5 on the front side. And if you're focusing back also, in very serious chronic cases, you can focus this 4, 5, 6. So 2 or 3, because this for treating chest, these 3 points can cover this chest region. Okay, so this is how you can select energy points. Okay, now we will focus now how to do massage. Once we have understood which energy point, then practical part now. Massage. On the yin surface, you can do clockwise massage. You do this massage until the skin becomes pink or warm. Yes, you see, it is very good that you do marking. You can do marking. Here I did with white color because to show these points clearly, and also this with this pen, easy to clean my hand. But if you are doing for treatment purpose, then you can use red color also. So clockwise massage on the front side. So you should do with this probe. So I'll demonstrate 1 or 2 points, and then you know that same pattern you will follow on all points. So on the yin side, you will do clockwise massage until the skin becomes warm or becomes pink. Clockwise massage, and you know that not very deep and also not superficially. It should be, you know, moderate, but patient should feel little pressure, and at the same time it should not be very deep. You should not create wound or scar here. But sometimes you will see when you do this massage with the probe, momentary you can see a black mark, and after few seconds or a minute, this black mark is dissolved. So don't worry about that. And this sometimes this is because of metal mark, metal color. So don't worry at all. Like this. This central point, especially I wanted to talk about this central point. This point has connection with the navel point. And this is very special. This is very special energy for fatigues and body pains. This central point is very, very effective. If you do, sometimes you can do just this one point and sit on the point, you will feel very good energy. And this point can, when you do this point, you can feel warmth on your body level. Your whole body level, you will feel warm. This point. This is very special connection with the navel and in embryo state, you were connected with your mother through navel. And when you're doing this treatment, start from down. Of course, we can start from up also, because as per diamond energy system, we have front central border meridian where energy is flowing from down to up, and back central border meridian where energy is flowing from top to bottom. But in CV meridian and GV meridian, energies are moving from down to up, and then it from anus it goes up, from down to up, and from side also energy is moving, and then finally this energy penetrates inside the mouth, and then deep inside it merges with the manus meridian, and then again it goes to the anus. So we will focus this kind of circulation down to up. Yang side, anti-clockwise massage. And because here, this is wrinkle area, you can make a fist. And you see, this probe has two ends. This ball is small and this side is big. You can use this big side and anti-clockwise massage. Like this. And how much time you can feel that? If you feel little pressure, warmth, yes, then it is done and you can go to next. So this is first step. You know, if you do this first sitting of energy point treatment, very next day you will feel vibrant, energetic, very good. You will experience this. Now, second thing is, in severe cases, it is very good to do moxa also. Yes, and if you don't have moxa, okay, then don't stop your treatment. After doing massage with the probe, then we will do seed therapy. Okay, but in case you have moxa, then it is very good. So moxa, now I'm not burning, but I just want to demonstrate. In moxa also, you can do on the inside. When you move clockwise, you can just move, and you have to keep your hand like this so that ash falls down after burning this. In clockwise direction, keep moving upward, but slowly, not immediately like this. You should feel, your skin should feel warm. And when you are doing this moxa therapy, some point can take longer time to create that warmth on the skin. For example, if I do it here, sometimes you will feel that just in a second, less than a second, I feel warmth here. Yes, and I can feel, oh, it's enough and I should go next. But when I come here and I am doing, but this point I'm not feeling warm, and I feel like I want to, I want more, as if my body is asking for more. So it means that this this point has blockage. This point needs more warmth. So you should do it more. So we cannot fix that, which point, on which point, how much time. So, and you have to see the distance also. You cannot touch, or don't bring very near, and don't go very far. Moderate. This you will experience when you do it on your hand. Yes, and if your point needs more, do it more. And if you feel, oh, this is enough, oh, I'm feeling heat, lot of heat here, even I am far, keeping my moksha far, still I feel a lot of heat, I cannot tolerate, then it means this point is full. This point does not need more moksha. You can come to next point like this. So in clockwise direction, but don't move very fast. Yes, I'm teaching you very systematically so that you can really experience the result. One sitting, if you do it perfectly, the very next day, you will observe great change in your body. In all chronic cases, in cancers, as I want to repeat so that you give special attention in cancers, in fibrosis, in very chronic, asthma diseases, heart blockages, yes, and in all kind of shrinking cases, we have to focus. But person who is having high blood pressure or acute cases or fever, it is hyper condition. In that cases, you don't do moksha, but you can do seed therapy on energy point. This is the difference. Okay. In hyper cases, we will not do moksha. Okay. So now on the yang side, you will make same. You will go from down to up in anti-clockwise direction. Slowly, slowly, you go upward and stop on the main point. Give more attention. This color is coming out from moksha, so you can ignore. And then you can stop. Then go next. Slowly, slowly go anti-clockwise direction and focus more on the point, stop, and then come. This is very good way. And of course, after that, you have to quench. You can use water. And then because of this wet condition, you cannot use moksha the same day. Next day, you can use. But if you want to use it again, then also another technique is in salt. You can, with the help of salt also, you can put up this. Now, how to apply seed? Before applying seed, I will show needles. Again, very good technique. People, those who are practicing acupuncture, I will show needles, and also I will show seeds. So for needle, we are using gravity inserter, and we are using Sujok needles, these needles. Okay, and it is not difficult. This acupuncture on hand system is very, very simple. You can do it easily. But for beginners, I recommend you can use seeds. For doctors, they can do needles. So with the help of gravity inserter, these are needles. So one side, one end of this inserter has magnet. You can pick up your needle with this magnet and then see the inserter in this hole. You see this needle, and before doing needling, you have to sterilize. You have to clean your hand with alcohol. You have to clean with you have to clean your inserter, patient hand, doctor hand. Yes, so all these cleanliness you have to maintain. And now see the needle. This needle, one end, this side, one end is spiral. So the spiral part will go inside this hole like this. Yes. And then take position. After taking position, keep it in a vertical position. Oh, sorry. Once again, shoot. Just a moment, please. I'll share my screen once again. Some technical issue. Give me 1 minute, please. I'll share. Okay. And sharing. Okay. So, once again, pick up, and then this spiral part of needle will go inside the hole. Take position, and then vertical angle of the inserter, and then drop and slowly take out. And here is the needle. Pick up, see, pick up. And now see how I am doing. Next. Then pick up. Spiral part will go inside the hole. Like this, you will put on all points. And in this, with this camera also you can see. So, and then take position and drop. Okay. So now you can, this way you can do on all points. And then you can keep these needles for 30 to 40 minutes. And then after 30-40 minutes, you can remove. Like this. Yes. And then you can do seeds also. So this is like, this is very good technique, acupuncture on energy points. But beginners, they can do seeds. Also, seeds also, black pepper, because this black pepper has medicinal property. We can use green fresh peas also. Yes, also we can do star magnets, and we can do vibrant seed. Idea is either you are using some medicinal property from this point of view, or you can use a seed which has vibrant color. And we can use crystals also, red, green. See these crystals, these are green color crystals. According to 6 key, this is wind energy, and red crystal, we can use this also. Crystals, red or green. So in fingers here you can see. So sometimes you can use finger system, sometimes you can use basic system. In case you are using black pepper, then good to use scissors so that your work looks neat. And black pepper is available in your kitchen. Paper tape is also very easy. You can find in your nearby chemist shop. Small pieces. Like this. After doing massage, you can also mark, as I told you, after doing good massage. And now to save time, I'm just cutting with my finger. But when you are doing professionally, then better you use scissors so that patient hand looks neat. But now I'm just using my hand. So after doing good massage, I'm fixing all these seeds. Don't forget to do massage, because if you just put seed without doing massage, then it is not working. And you can, because your complete hand is occupied, this treatment you can do before sleeping also. And then next day you can remove. Just see how I'm doing. On all energy point, and then you can decide which point you have to use. Or if you are doing for your general fitness, very good to do all points. But if you're targeting some part of your body, for example, I told you, if person has any problem in the leg, then lower 3 energy point also good enough. So when you are doing this energy point treatment, it is not necessary that you do the disease treatment the same day. Yes, of course you can do it, or you can do it on the other hand. We should not create traffic on the hand. For example, if your patient has chronic stomach disease, then stomach treatment you can do on the other hand. And on one hand, you can do energy point treatment. So this is how we have done on the yin side. And I'll show on yang side also. Now, the size of the tape, it depends, because you have to see how, now here in this place, see, maybe I should use little longer, big size, so that it can hold the skin. After doing energy point treatment, better you don't wet your hand. That is why it is very good to do before sleeping, because your hand, you can maintain these points, no work. Backside also. As I've told you that energy point treatment in all chronic cases, it is very important. Like this. It is not difficult. This is black pepper. And when you are doing this black pepper, you have to check also, because some black pepper seeds are damaged. You should not use damaged seed. This is hard. This is good. But sometimes seed is damaged, and as soon as you give little pressure, it is crushed and it becomes a powder. So don't use that seed. Now, Are you confident with this application? And then I'll go next. Are you confident with this application? In the chat box, can you do in your home? Yes, good. Okay, but before seeds, please do massage and then fix seeds one by one. Now, insect system. Now, like one day, if you have done basic system, this is called hand system. Second day, you can focus insect system. So this, all these points on the insect system, on finger system, it is also available on these fingers. But I always like to use this finger. In last session, I told you that this is according to tri-origin. This is hetero finger. Okay, there is a question, stick moxa. Actually, we have variety of moxas, but this is the most convenient smokeless moxa. You can use, we have thread moxa also, we have mini moxa also, stand moxa also. But you see, when we are doing this moxa, then very easy to jump from one to this point, because as I told you, you never know that this point needs more heat and this point needs less heat. And if I put all moxas, mini moxas, if I'm putting moxas all in one time, then it is very difficult for patient to realize that which point, yes, which point needs more, yes. But if you are using one, two or three energy point, in that you can use this moxa. This is also one kind of moxa. In market, it is available. This is sticker moxa. See, sticker moxa. You can, for example, patient has some problem. This is after, this is sticker. But if patient feels, because if patient needs more heat, then it is good to fix. Sometimes, as soon as you touch, patient cannot tolerate heat. It means this point is full. This point does not need more heat. But when I'm doing this in with my practice, I feel very convenient with this. But you can use, you can also try the sticker moxa, mini moxa, thread moxa. All have their, all moxas are good. But again, you should know rules of all types of moxas. So I'm teaching from beginner's point of view. For beginner point of view, this is very convenient. Very convenient. You can use this. So insect system, finger system. Now how to apply seeds on insect system. So this area, because points are nearby, sometimes you can, there are many ways to apply. You see, sometimes we can apply like this, but we need marking. So first we can do marking like this, like this. This is the technique, okay? And now, because my marking is ready, on finger system, green lentil seed, hara moong ki dal, green lentil, and you have to take care, this white dot of this seed will touch the skin. So I really want you to do it. You all should do this. If you have time today, you do today, or tomorrow you should do, because this is For maintenance also, like tonic. White dot will touch the skin. So from the last point, this way also. And this now, this kind of adjustment you can do. You can check whether my points are correct. Sometimes you see it slips also, but you can then redo. And then you can adjust. And reassure that seats are on the correct point. So in one go, I did all energy points. Same way on the back side. But when you do this way, you cannot bend your finger. So on the joint level, you can do little bit, just cut so that patient can bend finger. But at the same time, you can tell your patient not to move this finger so much. So this is technique. Like this. This is one way. Second is, you can use this because sometimes patient skin is, sweaty and sometimes dry skin. This is also one way. Two energy point, one time like this. This is artistic work. Like this. So when you're doing on the finger, don't do on hand. This is hand system. Yes. And sweating hand, better you do on finger, because on finger you can also wrap this. You can, if sweating hand is sweating, then you can roll down like this. Now it will not go anywhere. Okay. And then, as I told you, that you can do crystal also. Crystal, red, orange, or green. On all energy point like this. This way you can apply crystal also. So one day you do on basic system, second day you can do finger system, this so that skin gets rest. So this kind of combination you can do. And needles you can keep for 30 to 40 minutes, but seeds you can keep for 8 hours, 6 hours, no problem. You can apply seeds, fix seeds before sleeping, and next day you can remove this. Okay. So this is how you will do this seed therapy. And colors. Now, colors. In daytime, it is very good that you, of course, yes, on mini system, you need to exactly mark people, those who know mini system. Of course, if I see in chat box, crystals you can keep for 4 hours, and crystal also if you do it in daytime. in daytime. It is very good. So mini system, people, those who know mini system, very good to do needles because in small area you can cover. So in mini system, I'll just give you an idea if you know mini system. Exactly like this, here, 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 we have to divide same way. Yes, like this. So in mini system also you can do. But for beginners, basic system and insect system, because mini system is micro system and you have to maintain that accuracy. It is very, that system, because very small, this is very small area, and in small area we have points of complete body. Anyway, so this is basic system and insect system, energy point. Now, if you have any question, you can ask also, because I thought that this topic I have to give attention in all difficult diseases, in all our future lessons. Whenever I say add energy point treatment, then you have to see this recording. You have to revise this. And if you do this energy point treatment along with your main disease point, your patient will recover very soon, very soon. And now, please ask question related to this topic if you have any question. Yes, I saw in the chat box, in blood pressure, don't do moxa, you just do seeds. Also, I can see the chat box. And you can, yes, Nisha ji. I cannot
Hello.
hear.
Unmute yourself. Yeah.
Hello, ma'am.
Yes, yes, please. I
Ma'am,
can.
what about needling on the yang side?
Yes, the same way, same technique. I did it on yin side, but technique is the same on the yang side.
Okay, and when we are putting seeds on energy points, after that, can we do moxa also?
Yes, of course. And I think I will say it is very, very good. Before doing seeds, you do moxa. And after seed therapy, also you do moxa, because warmth of the seed will greatly enhance that energy point. It is
Okay.
very good. Before and after. On paper tape also you can do. On the top of this paper tape, because seed, when you do this, the seed can become warm.
Hello, ma'am.
It is very good. Yes, please.
Namaste, ma'am.
Namaste. Namaste.
Hello, ma'am.
Hello.
Ma'am. Hello. Ma'am, I have one more question.
1 minute, ma'am.
Hello.
Unmute yourself.
Yes. 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 Yes, please.
Ma'am,
Ma'am.
There is a question, but meantime, I can read this also chat box. Children, can we do it for children? For children, seed therapy, yes, you can do it, but moxa, don't do it, because small babies, sometimes they are shaking their hands, so it is not very easy to do moxa on baby hand. You need still hand. Yes, yes, but seed therapy you can do, of course. It is very safe. Seeds are very safe. Orange color, if you're doing color therapy, then orange color, because orange is symbol of hotness energy, and the red color is symbol of heat energy. So orange color you can do as a first choice, and second choice is red color. And green color also we can do, if sometimes we can do. But one more technique is that day 1 you do green color, day 2 you do red color, on energy points, and day 3 you do orange color on all energy point. On one point I will show so that you see the size also, like this. This much size. Yes, please.
Nitya ma'am, please finish your question fast.
Yeah, there was a net problem, so I couldn't ask. Hello, ma'am.
Yes.
Ma'am, if we have low BP, can we do MOXA?
Low BP, yes, we can do.
Okay.
Low or hypo condition, we can do.
Okay. Thank you, ma'am.
Hyper, don't do.
Ma'am, in diabetic neuropathy, we can use
Yes. 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 Please do it every day along with pancreas. And
ma'am,
you will learn all these points for diabetes, which points. Yes, but don't forget that this energy point treatment is additional treatment along with your main treatment.
ma'am, the patient having diabetic neuropathy and heart degeneration.
Yes. What
We
is your
can
question?
activate the energy system, all energy system,
Yes,
all
you
energy
can. It
point.
is very good. Yeah, you can do it.
Ma'am, uh,
Bulbul ma'am, your voice was not clear. Sorry. Mithilesh ma'am, please unmute.
Yes, please.
Mithilesh, please unmute.
You
Or
have to.
having the net problems, I think. Yeah. Okay. And just Swati, please unmute.
Hello,
Hello.
good evening, ma'am.
Good
Uh,
evening.
Ma'am, in this, the points that you showed at the back, can you show this point? Is it on this knuckle, the last, or it is below?
Can you see?
It's on the thing, on the
Yes.
point. Yeah.
Yes.
And this point, which you showed that it starts, no, this one, sorry, it starts raising. So it's on the bone.
Yes. See? Can you see?
Yes, ma'am. Now it's clearer. It's on the bone,
Yes.
on the top.
Yes.
Yes. Acha, ma'am, and when you massage these points, do you massage it with a cream or you just massage it with your hand too?
See, with probe, you can do accurate massage on the point because this point is very small.
Hmm.
And when you are doing massage with the thumb, it is good. If you don't have probe, it is also good. But it is like a muscular type of massage. It will also touch surrounding area so that you can miss that point also.
Okay.
So with probe, it is very good.
Probe it is better. Okay. Ma'am, can I ask you one question with the
Yes,
earlier
please.
this?
Mhm.
Ma'am, you know, after doing ring massage, whenever I start the ring massage, and there is so the pain activates, like my knee pain. I know my little bit of weak is knee, but my knee pain starts activating after doing a ring massage. Is that
Actually, with ring massage, there is no connection with this pain because ring massage, if we are doing correctly, it will relieve the pain. And this pain, if you're experiencing, this is part of some, this is due to some other reason. But you never know. Don't worry at all. You keep doing because this is very, very safe. Don't stop. Maybe this knee pain is coming.
and
Uh,
it will go away?
yeah, it is not related to ring massage. Maybe it is just as a routine, just as a routine. But please do your treatment properly. Do still, I say, do ring massage and do seed therapy on the point, knee point. Don't stop your treatment. And you remember last time I told that there is no side effect at all, no side effect of seed therapy, no side effect of ring massage. And I gave several examples, like ladies are working in the kitchen, farmer are working in the farmhouse, labor class working in the factories, they are working day and night, and many pricking, many sometimes many cuts come here, nothing happens. This is very safe. Only thing is that if you do treatment, if you touch correct point, result is coming. If you're not touching correct point, no result, but no side effect, no side effect at all.
Okay, ma'am. And ma'am, just one more thing. The buttock point that you showed last time, is it covering the whole of this, the buttocks? Like in the main system, means the basic system, it
Mm.
is the knuckle, the whole of knuckle.
This is like this is left buttock area and this is right buttock.
And in the insect
And
system,
center point of buttock, this is left buttock center, exact center point. And this is right buttock center. And in insect system, this lower area.
the
This is
lower
all
area.
buttock area. So you can, when you're doing ring massage in buttock problem, then make sure that you take any finger and you should push your ring towards this side,
Okay.
If you're, because without pushing, you cannot touch this area.
Correct.
So ring massage, while doing ring massage, you have to give special push so that you touch this area.
Okay, ma'am. Okay. Okay, thank you.
Thank you
ma'am.
so much, ma'am. Smile,
Thank you so
thanks.
much.
Actually, this is 10:07. We should not retain you more than 10 o'clock. Thank you so much, ma'am. Smile, thank you. And special thanks to General Chadda sir also because you are here with us. No, thank you so much. Thank you all participants. Thank you, Anisha ma'am. Thank you, Joshi sir. Thank you so much. We will meet again next time,
Thank
next
you.
Monday.
Next month. Thank you.
Fine, thank you, ma'am.
Before that, you have to come by seeing
Ma'am?
all the previous videos. Okay,
Ma'am,
Thank you.
I have one small doubt. Is there anything for the seed therapy, South Pole and North Pole, like magnets?
Yes, in some seats we have South Pole and North Pole. It will come in our coming sessions. Today my topic was energy point, and here we don't need that North Pole and South Pole criteria. So in coming sessions, you will see, you will study all these things. Stay in touch.
Okay, ma'am. Thank you.
Small thanks,
Ma'am,
ma'am.
one more small
Thank you, ma'am.
question.
Thank you so much.
Regularly, my daughter will be having the urine infection. Can I give a massage where you showed today?
Yes, and don't do moxa for her. Don't do moxa for her.
Okay. Can I put the seeds?
You can put seed, green lentil,
Yeah.
and also with the, if she has some some inflammation, burning sensation, then ice massage. Ice
Okay.
massage in this area for
Okay.
a few seconds, and then you can apply dark blue color also. This
Okay.
ice massage for few seconds, and here dark blue color.
Okay, ma'am.
And on one hand, you can apply green lentil seed.
Okay, ma'am.
Good, very good treatment.
Thank you. Thank you very much.
Hello.
Smile, thank you, and
Hello,
smile
ma'am.
night. Smile night. Smile, thank you.
Thank
That's
you.
enough for the day.
Fine,
Enough for the day.
Ma'am.
Thank you so much. Thank you,
Thank you,
ma'am.
ma'am.
Thank you.
Smile,
Thanks, ma'am.
Hello,
Thank you, ma'am.
you can
Thank
ask
you,
your
ma'am.
doubt
Have
and
a
get
nice
response,
day.
please.
Thank you, ma'am.
Madam,
Sure.
please
Thank you.
provide